All India Radio presents Morning News. Good morning. I am VC Pramod and with me is Tanvi Khurana. The headlines. Very severe cyclonic storm Taukte to further intensify during the next 24 hours, likely to cross Gujarat coast between Porbandar and Mahua early tomorrow morning. Centre issues guidelines to contain spread of COVID-19 in rural areas. Defence Minister Rajnath Singh to release the first batch of anti-COVID drug 2DG this morning. Bharat Biotech's Covaxin effective against coronavirus strains found in India and the UK. Lockdown in Delhi extended by another week, metro to remain shut. Himachal Pradesh government to launch COVID vaccination drive for 18 to 44 age group today. Rajasthan government to recruit 1,000 medical officers and 25,000 paramedical staff to deal with the pandemic. Delhi police arrests businessman Navneet Kalra in connection with black marketing of oxygen concentrators. United Nations Secretary General calls for an immediate end to fighting between Israelis and Palestinians. India also calls for immediate de-escalation and urges both sides to show extreme restraint. In tennis, Rafael Nadal beat world number 1 Novak Djokovic to win the Italian Open title. As the number of COVID cases are on the rise, we appeal to our listeners not to lower the guard, follow all the precautions, and all those above 44 years who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki doori for social distancing, focus on hand and face hygiene. And now the news. Very severe cyclonic storm Taukte is likely to intensify further during the next 24 hours and cross Gujarat coast between Porbandar and Mahua during the wee hours tomorrow. Indian Met Department DG Mrityunjay Mohapatra said at the time of landfall, wind speed is expected to be 155 to 165 kilometers per hour. With the cyclone Taukte moving northwards towards Gujarat, the state government has evacuated 1.5 lakh people from low-lying coastal areas in the state. The IMD has predicted heavy to very heavy rainfall in coastal areas of Gujarat today and tomorrow. Meanwhile, Gujarat Chief Minister Vijay Rupani reviewed the preparedness of the state administration at a high-level meeting at State Emergency Operations Centre in Gandhinagar last evening. A report.
Additional Chief Secretary of State Revenue Department Pankaj Kumar said that the state administration is fully prepared to minimize the impact of very severe cyclonic storm Taukte. He said that more than 150,000 people have been shifted to the safer places with COVID protocols. 44 teams of National Disaster Relief Force have been allotted to Gujarat and deployed in the coastal districts likely to be hit by the very severe cyclonic storm. 6 teams of the State Disaster Relief Force have also been deployed for rescue and relief works. Fishermen have been asked not to venture the sea for the next 5 days. Marine Police and Coast Guard are helping fishermen stuck in the sea for their safe return to the coast. Yogesh Pandya, Air News, Ahmedabad.
The Met Department has also predicted heavy to very heavy rain at isolated places in Maharashtra's North Konkan region, Mumbai, Thane and Palghar, and extremely heavy rainfall in Raigad today. Union Home Minister Amit Shah yesterday chaired a meeting with the Chief Ministers of Gujarat and Maharashtra and the Administrator of Daman and Diu and Dadra and Nagar Haveli to review their preparedness to tackle the situation. More from our Mumbai correspondent.
In Ratnagiri and Sindhudurga districts, people living near the coastline have been shifted to safer places. The Disaster Management Authority said that in Ratnagiri, more than 3,800 people, Sindhudurga around 144 people, and in Raigad, 2,500 people have been shifted to safer locations. In Palghar, the impact of very severe cyclonic storm Taukte has been felt. According to the Palghar District Collector, an urgent meeting of the Disaster Management Authority was convened late last night. Due to the strong winds, there was no power supply in the region since early morning. In Ratnagiri too, the impact of very severe cyclonic storm Taukte was felt in Rajapur and nearby villages along the coastline of Ratnagiri Taluka. Incidents of tree felling, disruption in power supply due to snapping of electric wires have also been reported. However, there are no reports of any loss of life in any of these places. Kunal Shinde, AIR News, Mumbai.
The NDRF has deployed more than 50 teams in Gujarat ahead of the landfall. The Indian Air Force has stationed 16 transport aircrafts and 18 helicopters on standby. The Indian Coast Guard disaster relief teams with inflatable boats and life jackets are on standby all along the western coast for undertaking disaster response operations. The Coast Guard has also kept its medical teams and ambulances in standby for swift mobilization. Vaccination drives against COVID-19 will remain suspended across Gujarat and parts of Maharashtra today in view of Tokte. In Kerala, the water level in many dams increased after heavy rainfall in some areas. The power supply in many areas of Goa was disrupted as hundreds of electric poles were uprooted due to high-speed winds.
Commerce and Industry Minister Piyush Goyal and Minister of Ports, Shipping and Waterways Mansukh Mandavia interacted with industry leaders about the likely impact of very severe cyclonic storm Tokte and preparedness for facing it. The meeting was called on the directions of Prime Minister Narendra Modi yesterday. It was also attended by senior officers of the Indian Meteorological Department, the Ministry of Ports, the Shipping and Waterways, and the Railways Ministry, NDMA, and states of Gujarat, Maharashtra, Goa, and Union Territory of Dadra and Nagar Haveli and Daman and Diu. In the wake of COVID-19 pandemic, the issue of continuous availability of oxygen, maintaining buffer stocks of medicines and essential items and well-being of patients in the areas likely to be affected was stressed upon in the meeting. Smooth functioning of communication facilities and other utilities also came up in the meeting. Mr. Goyal said the views expressed by the industry participants and the state officials show their confidence and readiness in handling such a natural calamity in an effective manner. He said, power will be the major focus area as the same has to be switched off due to safety reasons for some time but should be restored quickly as per the conditions. The minister said there is a merit in making available satellite phones at strategic places for better communication. He expressed satisfaction at the fact that the industry has stored emergency spares and fuel for the duration. Mr. Goyal urged all of them to keep their eyes and ears to the ground and work in the spirit of cooperation. He said 24/7 control room to monitor cyclone progress is already functioning while intensive patrolling of assets, OHE and track has begun. The Railways has also taken several measures to ensure uninterrupted supply of oxygen. The minister said relief material should be properly channelized so that the common man gets the relief and the unscrupulous elements are not able to take advantage of the situation. He urged all the big industries to look after their local areas to support small industries, suppliers and neighborhood industry associations. Union Health Secretary Rajesh Bhushan, along with Member Health Niti Aayog Dr. V.K. Paul, chaired a high-level video conference meeting yesterday with all the states and UTs. The focus of the meet was on COVID-19 containment and management in peri-urban, rural and tribal areas along with the effective clinical management of COVID-19, including the black mucormycosis fungi, which is being recorded in growing number of states. The meeting assumes importance in the context of the rural hinterland of the country, recording very high number of cases with increasing fatality and positivity rate combined with low reported levels of testing. Both urged states to ensure community-based and primary health center services to manage the situation and stressed on sensitization of ground workers, particularly medical officers and block-level nodal officers on containment, surveillance and use of rapid antigen test for screening, use of RT-PCR and teleconsultation. The state health secretaries were asked to hold daily regular review meetings starting today with medical officers and block-level nodal officers to ensure that the SOPs and the advisories percolate to the grassroots level. The states were urged to organize series of meetings or interactions for sensitizations of the ASHAs, ANMs, Panchayati Raj institutions along with the community health officers. The states were advised to train them to identify the early signs of influenza-like illness or severe acute respiratory infections and COVID symptoms. The states were also advised to use the services of village-level health and sanitization committee and Gram Sabha as first responders. Mechanism for surveillance, screening, isolation and referral of cases from such areas, monitoring of home isolation cases and providing them for information pamphlets, ramping up of facilities in all the three subsequent levels of COVID-19 health care, COVID care centers, dedicated COVID health centers and dedicated COVID hospitals was discussed at length. The states were exhorted to share their best practices and leverage their existing capacity in teleconsultation. The need to ensure continuity of non-COVID essential healthcare delivery systems, communication and behavioral change and renewed parallel focus on mental health support were also highlighted. The Secretary urged the states to break the myth that CoWIN platform is biased to those abled by technology and requested them to make good use of facilitated cohort registration.
Defence Minister Rajnath Singh will release the first batch of anti-COVID-19 drug 2DG through video conferencing this morning. The drug has been developed by DRDO's Institute of Nuclear Medicine and Allied Sciences, INMAS, in collaboration with Dr. Reddy's Laboratories. A report from our correspondent.
Clinical results have shown that this molecule helps in faster recovery of hospitalized patients and reduces supplemental oxygen dependence. Higher proportion of patients treated with 2DG showed RT-PCR negative conversion in COVID patients. The drug will be of immense benefit to people suffering from COVID-19. Pursuing Prime Minister Narendra Modi's call for preparedness against the pandemic, DRDO took the initiative of developing anti-COVID therapeutic application of 2DG. Being a generic molecule and analog of glucose, it can be easily produced and made available in plenty in the country. The drug comes in a powder form in sachet, which is taken orally by dissolving it in water. It accumulates in the virus-infected cells and prevents virus growth by stopping viral synthesis and energy production. Its selective accumulation in virally infected cells makes this drug unique. The drug is expected to save precious lives due to the mechanism of operation of the drug in infected cells. It also reduces the hospital stay of COVID-19 patients. Anupam Mishra, AR News, Delhi.
Indigenously developed Bharat Biotech's COVID-19 vaccine, Covaxin, has been found effective against coronavirus strains found in India and the UK. A study published in medical journal Clinical Infectious Diseases said that the Covaxin has been found to successfully neutralize all key emerging variants tested, including the double mutant strain B.1.617 and B.1.1.7. The study was conducted by the National Institute of Virology and the Indian Council of Medical Research. The Covaxin is one of the 3 COVID-19 vaccines that are currently available in India. Days ago, the Covaxin became the first COVID-19 vaccine to receive a nod by the Drugs Controller General of India for conducting Phase 2 and 3 trials on children aged 2 to 18 years in India. The trials are expected to be completed in the next 2 to 3 months. The centre has said that it plans to ramp up the production of Bharat Biotech's Covaxin from 1.5 crore doses to about 10 crore doses every month. Niti Aayog member Dr. V.K. Paul said total production of Covaxin doses will be further scaled up to 13 crore doses a month when 3 public sector undertakings start manufacturing the vaccine. The country has administered more than 18 crore 22 lakh doses of COVID-19 vaccine so far. The Union Health Ministry said that more than 17 lakh 33,000 beneficiaries were inoculated with COVID-19 vaccine doses in the last 24 hours. Out of this, more than 11 lakh 19,000 beneficiaries were vaccinated for the first dose and nearly 6 lakh beneficiaries received second dose of the vaccine.
The Health Ministry has informed that in the last 24 hours, the nation registered 3,11,170 new COVID cases. Over 3,62,000 people have recovered, and with this, the recovery rate has further improved to stand at 84.25%. So far, over 2 crore 7 lakh people have recovered from the COVID-19 infection in the country. The cumulative share of active COVID cases in the country has declined to comprise nearly 14.66% of the total reported cases. Currently, over 36,18,000 people are reported to be suffering from the viral pandemic and are either hospitalized or are under home isolation. You are listening to the morning news on All India Radio. A reminder of the headlines before we move on. Very severe cyclonic storm Tauktae to further intensify during next 24 hours. Likely to cross Gujarat coast between Porbandar and Mahua early tomorrow morning. Centre issues guidelines to contain spread of COVID-19 in rural areas. Defence Minister Rajnath Singh to release first batch of anti-COVID drug 2DG this morning. Bharat Biotech's Covaxin effective against coronavirus strains found in India and UK. Lockdown in Delhi extended by another week, metro to remain shut. Himachal Pradesh government to launch COVID vaccination drive for 18 to 44-year age group today. Rajasthan government to recruit 1,000 medical officers and 25,000 paramedical staff to deal with the pandemic. Delhi police arrest businessman Navneet Kalra in connection with black marketing of oxygen concentrators. United Nations Secretary General calls for an immediate end to fighting between Israelis and Palestinians. India also calls for immediate de-escalation and urges both sides to show extreme restraint. And in tennis, Rafael Nadal beat world number 1 Novak Djokovic to win Italian Open title. For quick news updates round the clock, follow us on our Twitter handle at AIR News Alerts.
चलो मिलकर एक शुरुआत करें, चलो एक फैसला आज करें, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे, चलो एक इरादा करते हैं, चलो खुद से वादा करते हैं, मास्क नहीं तो टोकेंगे, कोरोना को रोकेंगे.
The Delhi government has extended lockdown in the national capital by one more week. Delhi will now remain under strict lockdown till 5 a.m. on the 24th of this month. Informing the decision to the media, Delhi Chief Minister Arvind Kejriwal said that substantial gain has been made in the capital city in terms of recovery and reduction in the positivity rate in the past few weeks. The Delhi Metro Rail Corporation has said that in the wake of the extension of curfew in the national capital, the Delhi Metro services on all its lines will also remain suspended till further notice. It said any change in services will be notified. The Himachal Pradesh government will launch COVID vaccination drive for 18 to 44 age group today. For this, 213 centres have been made across the state where vaccination will be carried out. A report from our Shimla correspondent.
Today, the first dose of COVID vaccine will be given to 21,090 individuals of state who have registered online for vaccination in this category. To avoid unnecessary crowds at this center, the state government appealed to all individuals to come at vaccination center as per their schedule only. Vaccination will be given only to those who have booked their schedule on COWIN portal beforehand. There will be no on-site scheduling for the age group 18 to 44. It may be recalled that the state has recently received 1,07,620 doses of Covishield vaccine from Serum Institute of India, Pune for this category. The next date of vaccination for 18 to 44 years will be on 20th of this month and sessions for the day will be published on COWIN portal on 18th of this month. Sanjeev Sundaryal, AIR News, Shimla.
The Rajasthan government has decided to recruit 1,000 medical officers and 25,000 paramedical staff on urgent contract basis to deal with the COVID-19 pandemic. These medical personnel will be deployed in primary health centres and community health centres. The decision was taken at a high-level COVID review meeting chaired by Chief Minister Ashok Gehlot. In Madhya Pradesh, Corona curfew imposed in Bhopal since April has been extended till 24th of May in order to stop spread of pandemic. The Corona curfew will continue till 6 a.m. on 24th of May. In Chhattisgarh, a virtual school is being set up so that children's education is not affected due to corona crisis. This virtual school will operate under the Chhattisgarh State Open School. More from our Raipur correspondent.
All schools have been closed for the past several days due to the COVID-19 pandemic. In such circumstances, to impart online education to the children affected by COVID crisis and ongoing lockdown, Chhattisgarh government has launched a virtual school using information technology. Students from class 9 to 12 will be able to take admission in this virtual school. From the admission process to the studies and examinations, all the work will be on virtual platform. Students will also have the facility to choose a mentor of their choice and get their doubts cleared online. The syllabus of this virtual school has been curtailed to 70% in comparison to the Chhattisgarh Board of Secondary Education syllabus. Vikalp Shukla, AIR News, Raipur.
Bihar is witnessing a decline in fresh COVID-19 cases. The state's recovery rate has improved to 87.89%, while the positivity rate has declined to 5.73%. Over 5,72,000 people have recovered from the infection so far. The Odisha government has mandated dedicated help desk with helpline number at each of the COVID treatment centers across the state. In an order issued yesterday, it has directed that the help desk must operate 24/7 to share information with the attendants of the COVID-19 patients undergoing treatment. More from our Bhubaneswar correspondent.
The COVID treatment facilities are also directed to make provisions for TVs, cameras and CCTVs to facilitate direct interaction between the patient inside and his or her attendants waiting outside in a dedicated conference room. The COVID centers have also been advised to share audio and pictures of the patients with the attendants through social media platforms like WhatsApp. Meanwhile, the state is still battling the viral virulence despite lockdown that continues to infect about 12,000 people every day since the last few days. The good part, however, is the recovery of adequate number of patients on a daily basis, as evidenced by the recovery of 10,781 patients against a fresh addition of 11,732 cases during the last 24 hours. Girish Chandra Das, AIR News, Bhubaneswar.
Punjab Chief Minister Captain Amarinder Singh yesterday ordered extension of all existing restrictions in the state up to 31st of May, with directions for strict enforcement of all the curbs. In Jammu and Kashmir, the Corona curfew presently in force in all the 20 districts of the Union Territory has been extended till 7 a.m. on the 24th of May to contain the spread of coronavirus infection.
The Delhi police has arrested businessman Navneet Kalra, who is accused of black marketing of oxygen concentrators. Officials said he has been arrested from a farmhouse in Gurugram. Kalra was missing after over 500 oxygen concentrators were recovered from his restaurants in the national capital. The Delhi police had issued a lookout circular against the businessman. A few days before, the Delhi High Court had declined to grant him interim protection from the arrest in this case. The International Invincible Gold Medal of this year has been conferred on Union Minister Dr. Ramesh Pokhriyal Nishank. Maharishi Organization's worldwide president, Dr. Tony Nader, said Dr. Nishank has been recognized for his extraordinary commitment and outstanding service to humanity through his writings, social and illustrious public life. Dr. Nader lauded the Union Education Minister for his continuous support and commitment to the World Peace Programme and propagating ancient Vedic values, wisdom and traditional knowledge in the most scientific manner. The honor was announced at a 2-day virtual session which was attended by representatives from over 110 countries. The award will be formally presented to the Union Minister on Guru Purnima this year. Dr. Tony Nader also congratulated Nishank for the new education policy. He said the new education policy crafted by the centre will go a long way in establishing human values globally as a base of modern education. In his address, Dr. Nishank said that he was grateful to the selection committee and he dedicated his award to all the corona warriors who are risking their lives to save the patients in this difficult time.
United Nations Secretary-General Antonio Guterres has called for an immediate end to the fighting between Israelis and Palestinians. Mr. Guterres warned the UN Security Council meeting that the fighting could plunge the nation into an uncontainable crisis. He opened an emergency session of the Security Council yesterday to discuss the worst outbreak of violence in years in Palestine and Israel. calling the violence that has killed nearly 200 people over the past week utterly appalling. He said the UN is actively engaging all sides towards an immediate ceasefire and called on them to allow mediation efforts to intensify and succeed. India has urged both Israel and Palestinian sides to show extreme restraint, saying immediate de-escalation is the need of the hour. Issuing a statement, India's permanent representative of India to United Nations, T.S. Tirumurthy, urged both sides to desist from actions that exacerbate tensions and refrain from attempts to unilaterally change the existing status quo. He also spoke about the death of Soumya Santosh, who was killed when Hamas fired rockets on Israel's Ashkelon. Mr. Tirumurthy said India has also lost one of our nationals, a caregiver living in Israel, in this rocket fire. He also mourned her demise along with other civilians who have lost their lives in the current cycle of violence, provocation, incitement and destruction. Northern frontiers of Himalayas, its land of high passes and mountains. Any communication in Ladakh topography is always a challenge. Despite challenges, All India Radio is leaving no stone unturned to provide services to the listeners of this part of the country. On Golden Jubilee year of AIR Leh, our correspondent has filed the story.
For the last 50 years, All India Radio Leh has been serving in a difficult terrain to provide information, education and entertainment. In a sparsely populated Ladakh region, All India Radio Leh under Prasar Bharati is striving continuously to serve better. As Direct to Home, popularly known as DTH, has reached nook and corners of the country, AIR Leh is also taken on DD Free Dish as channel number 41. Ladakhi's favorite All India Radio on DTH has changed their listening experience altogether. Now, far-flung villages also receive digital clarity signal on DTH. A villager of Mooth near Nyoma, Mr. Sangdup says,
हम रेडियो का प्रोग्राम सुनते हैं जी, मगर हम टीवी डीटीएच में सुनते हैं, न्यूज ही सुनता है। जो डीटीएच वाला साफ आता है जी, शाम को न्यूज 7 बजे आता है, वो सुनता है जी, उसका लेट भी आता है।
Especially when schools were closed due to COVID-19 pandemic, serving by its motto, AIR Leh with the help of Leh Hill Council ran radio classrooms regularly with digital clarity for 10th and 12th class students in Leh Ladakh. With District Dolma in Nyuma, this is Ramesh Chandra for All India Radio News Leh.
In tennis, Rafael Nadal beat world number 1 Novak Djokovic to win the 10th Italian Open title last night. Second seed Spaniard Nadal won through 7-5, 1-6, 6-3 against the defending champion. Nadal also equaled Djokovic's record of 36 ATP Masters 1000 titles in his 12th Rome final. The women's singles title has been won by Polish teenager Iga Swiatek.
Now let's take a look at the weather forecast for today. The national capital Delhi will have partly cloudy sky with possibility of development of thunder lightning. Temperature will be between 24 and 38 degrees. Kolkata will have partly cloudy sky. City had a minimum temperature of 29 degrees and maximum is expected to be around 37 degrees.
And now an overview of today's newspapers. Western coast on edge as cyclone intensifies, headlines the Hindustan Times on its front page. It further adds high tidal waves and winds gusting up to 165 km per hour as severe cyclonic storm Taukte hurls towards Gujarat coast. Weekly COVID cases fall for the first time in second wave. Lockdown extended for a week in Delhi NCR, says the Times of India.
And now, before we end the bulletin, the headlines once again. Very severe cyclonic storm Taukte to further intensify during next 24 hours, likely to cross Gujarat coast between Porbandar and Mahua early tomorrow morning. Centre issues guidelines to contain spread of COVID-19 in rural areas. Defence Minister Rajnath Singh to release first batch of anti-COVID drug 2DG this morning. Bharat Biotech's Covaxin effective against coronavirus strains found in India and the UK. Lockdown in Delhi extended by another week. Metro to remain shut. Himachal Pradesh government to launch COVID vaccination drive for 18 to 44 age group today. Rajasthan government to recruit 1,000 medical officers and 25,000 paramedical staff to deal with the pandemic. Delhi police arrest businessman Navneet Kalra in connection with black marketing of oxygen concentrators. United Nations Secretary General calls for an immediate end to fighting between Israelis and Palestinians. India also calls for immediate de-escalation and urges both sides to show extreme restraint. In tennis, Rafael Nadal beat world number 1 Novak Djokovic to win the Italian Open title. And with that, we end the morning news. Have a nice day.